Welcome back to Medicare for Dummies. You've talked to your agent. You already have some idea what you want to do. Now I'm going to ask you to do the hardest thing, and that is to be truthful with yourself. Don't laugh at me. You got to be honest with yourself, because we're going to ask you, we the insurance agents are going to ask you some questions that you need to decide by yourself. What's your budget? Everybody tells me they're poor. Okay, I have millionaires. I'm in their house. I know they're not poor. You know, they have like $700 designer dogs running around. They're not poor. I had to go through a gate. Everybody says that their budget is very tight. How tight is your budget? How important is money? Does saving 20 bucks a month mean something to you? For some people, that means a lot. Other people, it doesn't mean anything. So when we say how tight's your budget, don't tell us tight. It doesn't save us any time. How important is your relationship with your doctor? Again, everybody's like, I don't really care, I don't like my doctor, or I love my doctor. How important is it? Is it worth an extra $100 a month that you can go to that doctor? And some people say yes. I have Parkinson's, I love that neurologist, she's my third one, I'm not switching, I will pay extra to go to her, because you might have to. We might put you on a plan that she's out of network and you're going to pay extra, double your doctor copay, to see her, and that might be worth it. Again, you got to be honest with me. Some people say, oh, I don't really care about my doctors. But then when it comes down to it, when you're sick, you do care. You don't want to get new doctors. You don't want to go into a new system. You know yourself. You know your spouse. I need you guys to be honest about this. How much do you travel? And then the same thing. People are always like, oh, we don't travel very much. Whoa. Well, my daughter lives in Nebraska, and we spend a week with her every year. My son's in New York. We try to get out there and spend about 2 weeks, see the grandkids. You know, if you're going to be out of your home area, your home network, I need to know that, because that's going to make a big difference if you buy a plan with a network. How much time do you spend out of network? A lot of people say, we're going to travel a lot. We want to travel. We're retiring, and we're going to see the country. But then they don't. They don't really like to do that. They're never gone. So we need to know the real answers. You thought when I said be truthful, you're going to have to be truthful about your health. Your health's not as important when you're turning 65, when you're getting ready to retire. Because in general, I'm not going to ask you any health questions. So you can keep all that. I'm used to people lying to me for health insurance. I've been doing this my whole life, but I don't need to know about all of the different health things. I need to know some of the other things about how the sausage is made to recommend the right thing for you, how much you travel, how much you like your doctors. What is your tolerance for change? Because we have two different Medicare products. And one is going to have virtually no change for the rest of your life, minimal. One is going to have constant change, annually, and sometimes cataclysmically, annually. You know if you're one of those people that can tolerate change, one of those people that's inflexible. You want to know exactly what you're paying every month. You want to know your budget. And it might not be because your budget's tight. It's just that's your personality. You don't like change. You don't like surprises. You're not as flexible with these things. You hate it. You want to know what it's going to be. You want to be done with it. So those are some of the intangible things that people won't talk about. Everybody wants to sell you insurance. They want to look at numbers on a page. Plan F, $139 a month. Part D, $33 a month. Boom. Well, you can do that. What an agent brings to the table is all those intangibles. He's talking to you about all the other things. And if your agent's not talking to you about those things, call us, let us recommend an agent that's close to you.